In 2003, the board of Holy Cross Hospital created the Legacy Society to honor those extraordinary individuals who have left their mark on the very heart and soul of the hospital. Tonight, we celebrate 5 outstanding 2012 Legacy Society inductees. Ruth Manchester, a role model in caring for others in the hospital and the community. Alyssa Mulligan, a dedicated innovator and a committed advocate of quality health care. Marty Squitero, a compassionate and generous volunteer and friend. Sandra Sandy Wolk, a leader in the volunteer community and a strong advocate for volunteer recognition. And the late Dr. Richard Dick Levin, a leader among the medical staff and a pioneer fostering collaboration between hospital administration and physicians.
Ruth's lasting legacy with Holy Cross Hospital will be the IV therapy team. In 1991, Ruth was a clinical nurse in oncology and participating on a committee, and that committee was talking then about the high incidence of infection rates. And Ruth believed that that did not have to be. She lobbied and advocated until she was given the permission to start an IV therapy team. And 21 years later, the hospital can say that the incidence of infection rates for IV lines has been significantly decreased. She's a visionary. She's also tenacious. If she has an idea, not only does she have an idea, she also has a simple plan for executing that idea. She's able to really and truly energize others to see the vision and to want to participate in seeing it to the end. Ruth is a caring person, and her mission has always been, and I believe always will be, to help others and to empower others, as well as to change systems so that health care can be had by all.
Alyssa started her career at Holy Cross Hospital in 1970 as a nurse in critical care. One of the things that she did was then progress on to helping establish a quality program within nursing, and over the last 10 or 12 years she's been a critical part of the performance improvement process and structure across the entire hospital. Alyssa is the go-to person for us around core measures. She's really been at the heart of what we've done, not just for patients with heart attacks, but for all of the clinical processes here. She's really been one of the key players in our work around core measures and in our obtaining top performer recognition from the Joint Commission and Delmarva Excellence Awards. She is one of the ones who's really made this happen here. Alyssa is hardworking, she is patient-centered, she is focused and indefatigable in seeing that we do the right things for the patients who come here. Alyssa's legacy here at the hospital will be one of faithfulness, I think, to the mission, to the nursing profession, and to an unending commitment to providing quality of care and seeing that we do it consistently across the board for every patient every day.
Ask any volunteer who served under Sandy Wolk during her time as volunteer director, and I believe without exception they would say she was a caring director, and more than that, she knew her volunteers. Sandy's most successful accomplishment was simply serving for a long, long time as a volunteer director. She brought a lot of favorable notice to the hospital. Her volunteers and their accomplishments were publicized in several of the local community papers, and that, of course, redounded favorably to the hospital. She's a very faceted woman. She's very bright. She's deeply committed to her role in the hospital and in whatever undertaking she may believe in, and they are many. I was fortunate. I feel privileged and fortunate to have been one of Sandy's volunteers.
I knew Dr. Levin from way back when I was a resident at the hospital center when he was a pathologist there. And when the previous director of the lab here retired, Dr. Levin was recruited for here, which was a really good thing for the hospital. Dr. Levin was an excellent anatomical pathologist, and he was a superb clinician, able to communicate very effectively with the medical staff, the residents, and students. He brought the laboratory at Holy Cross Hospital into the modern era with new equipment, outstanding personnel, and he was able to be innovative in the ideas and elevating the standards of the laboratory up to the highest degree. He was an easy person to talk to. When you discussed a case with him, you were getting really complete consultation. He was able to interpret a lot of the laboratory studies that in critically ill patients was confusing to the clinician, and he was able to communicate these things extremely well.
Marty came to Holy Cross Hospital not long after her husband passed away as a way of paying back Holy Cross for all the kindness that they gave her. The best way I can describe Marty is her friendliness, her generosity, and her spirit to help others. Marty has many accomplishments to her name. Most recently is the Salute to Seniors Award. She won for the state of Maryland. We at the Auxiliary are so proud of her. She won out of over 1,500 applicants to be named the best volunteer in the state, which of course pleases us and the hospital to be named the best volunteer in the state. And I think she has other accomplishments which you may not see, raising money behind the Auxiliary's name and through the gift shop. Holy Cross is her life and she loves it here. She gives her all to this place. She knows the future is Holy Cross. Her legacy is here. It doesn't have to be on a wall or on a plaque. It's just here, and it will be. And it'll be in all that love her in our hearts.
Tonight, the Legacy Society also celebrates past inductees, those who have honored Holy Cross Hospital with their service and have touched the community with their commitment and compassion. They are the people we entrusted with our lives, mentored us in our careers, and are proud to call our friends.